Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. I'm super excited about our guest today.
Yes, I love when we get the chance to have a repeat guest because we had him for just a small little snippet on a very specifically focused conversation. So I'm very excited to welcome back Dr. Glazer.
Yes, indeed. Dr. Glazer, welcome back to Dean's Chat. As you know, being a previous guest, we're pretty informal. If it's okay with you still, let's go first names. Devon, Joe, and Jeff.
Go for it. Have a great time with it. I'm happy to be back. It was so enjoyable last time I was here. So this is a pleasure to be back on with you guys.
Well, thank you so much for carving out the time. I know we just had the switch in daylight savings, and it's always funny for us because we don't switch in Arizona. So everything gets really messed up because everyone around us switches. So we basically switch, but we don't. So it's really awkward for like 2 to 3 weeks in Arizona. But welcome back. I'd love to start with just kind of a brief intro, and then I really look forward to diving into some of the topics with you. So currently you're the owner and CEO for Artesian Foot and Ankle Specialists in Laguna Hills, California, but you're also the Fellowship Director for Balance Health, Director of the Surgical Fellowship, and you graduated from the University of North Texas with your Bachelor's of Arts in Applied Sciences, went on to complete your Podiatric Medical School degree at the New York College of Podiatric Medicine, did your residency program, 3-year surgical residency program with Cornell, Columbia Health System. And I'd love to find out, I was looking at your website for your practice. You had worked in New York for a while, and then you made the big switch of going from coast to coast to move to California, open a practice. Tell us a little bit about what sparked that.
Yeah, it was my dad and my stepmom had lived here for probably 20 years at that point, and they kept saying, you have to come out to California, you have to come out to California. And as much as I love New York City, enough dreary winters kind of wear on you over time. The old thing of like walking back to your apartment and getting splashed by a taxi cab and some brown snow that was, slushy and left around. That just resonates in my brain of like, I've got to get out of here, right? And I had a good opportunity with a very, very small practice here in South Orange County. And I said, okay, why not take it and give it a try? I had nothing to lose. The other part of it too is that I didn't realize this till later, but New York and the East Coast kind of trains in a certain methodology. West Coast kind of at that time had a much different methodology. And the reality is, I think I'd maybe done one medial approach bunion the whole time I was in New York. And I came out here and everyone did medial approach bunions. And I was like, well, I know the anatomy once I'm inside the skin, but like this is viewing at it from a different angle. So the upside of that was it gave me a much different eyesight of what else is out there and what I might have not captured during residency from an educational level, and just other people's different takes on how to do our very niche profession.
Oh, I love that so much. And before I throw the ball back to Jeff, I'd love to piggyback off of that. How long had you been in practice before you moved?
Oh, I had not. This was fresh out of residency. I was
Okay.
super green.
Yeah. So this idea, Brian Loader called it the comfort curve. And I loved that so much because it's not really a learning curve. You know how to do the thing that you're trying to do. It's how comfortable are you adopting something that's slightly different or slightly augmented or a little bit adjacent to what you're comfortable with. Can you talk about how you overcame that comfort curve or what that experience was like? How did you do that?
I mean, I was lucky. I was part of a group where we had a couple older, well-seasoned docs, right? And so I would scrub cases with them, and they were kind enough to scrub cases with me. And I just gleaned off what they had learned because they were trained here. So they would do things slightly different than what I would do in New York. Same outcome at the end of the day, but the technique of how to get there was completely different. And that's where I go, wow, this is interesting to see how folks do things much differently than I was trained, still getting a good result. And I think as a surgeon, it's critically important because if you get into a hard spot, you want to have that skill set where you feel like, oh, I can adapt to this quickly, right? With equanimity under stress, which is the term, right? The nice way of saying don't let them see you sweat, right? Is that okay? I'm presented with this intraoperative situation. I've never tackled it in this way before, so more experience with other ways of training, I think, is always a good thing. And this is kind of the basis of why I wanted to have a fellowship, why I wanted to start a fellowship from that standpoint. And so I don't know if you want me to get into it, but I'm happy to kind of go into that portion of it as well.
Yeah, but first let me just check. Jeff, did you want to? Because I'm
No,
gonna.
I want to go that direction too. Can I just kind
Yeah.
of deviate just 1 second? Devin, I'm always interested when someone goes to school like in North Texas and you end up in New York City, but your family's in LA. I mean, that had to be a huge move in and of itself also, right?
Well, I would guess you'd say I'm adaptable.
Yeah, I would
Yeah,
say.
yeah. I literally moved to New York with a pickup truck,
Oh my.
and yeah, and so I had a pickup truck in New York City, and then after I found someone sleeping in the back of it, I knew it was time for that truck to go. But it was I always wanted to kind of garner a different experience from wherever I lived. And each one of those kind of taught me life lessons. But I grew up in Texas. My family was from New York. So I'd always stay with my grandparents a few months every summer growing up. And I always had a heart there. So I was like, okay, what a great place to get, medical training. And after that was completed, I still had the appetite I want to expand and learn more and try something different. Because the way I looked at it is, I was young. If it didn't work out, I could always move back to New York. I'm sure I could always find a job. And it was like, this should be a new adventure, but also expand my acumen as a surgeon of, what am I really going to know or learn as I get older, right? Because those first years really kind of set the tone for what you're going to do later.
Yeah, and you always have a turning point like brown snow getting all over your dress clothes, and you're like,
Yeah.
you
Yeah,
know.
that's a real good way of like, I'm tired of this place. Get me out of here, man.
Well, I appreciate that sidebar, but yeah, let's get on and talk about the fellowship because Devin, as you know, fellowship is a hot topic in our profession right now, and there's fellowships sponsored by ACFAS and fellowships sponsored by CPME, and so the students. It's starting early, right? The students are asking questions about it, and certainly the residents are planning the next chapter of their life. Love your take on that.
It is, thank you. It came down to that whole experience of learning things differently from different practitioners. So looking, people go like, well, why do I need a fellowship? And some may not at all. But if every question, and this will give my secret away at the ACFAS breakfast, right, for fellows, but I'll ask them like, what do you think you're missing out of your fellowship? And, be honest. And some will say, this or that. I go, because you really want a deficit to be filled by a fellowship. And each fellowship is a little bit different. And you want to make sure that fellowship complements the deficit that you believe that you have, because that way it'll give you everything you need to go forward as a good surgeon. And you also want to make sure that, the directors that are out there, you have a good personality. Where you guys can get along and feel comfortable with one another. So it creates a good adaptive learning environment. I think the biggest issue is that if you get out of residency and you feel like, I have this deficit, I haven't filled this deficit, the likelihood of you filling a deficit in your training is after that probably won't happen. So then you're kind of pigeonholing yourself to one learning acumen. Now, I do believe in the whole lifelong learners statement. I think that's a wonderful motto. But I think something about being a fellow and almost feeling in a safe environment of that you can grow your education within that environment makes the difference. For me, the reason I wanted to start one is because I felt that initial experience I had of learning different things from different doctors was really formative for me to expand on my career. And I want to offer that to everybody. The the upside of that is that you don't necessarily even have to go like, oh gosh, I want to do Charcot reconstruction. But what it does teach you is, what do I need to do in that moment to get that patient to the right practitioner if you don't feel comfortable doing it?
I have one more question, Joe. The deficits you're talking about, are those technical deficits? Are they confidence deficits? Are they a combination of the above? What do you see when you're interviewing residents?
Yes, all the above kind of, and that's what I ask them, right? Because it may be confidence, like, hey, I don't feel confident doing certain things, or I felt like I missed this during my, residency. I clicked all the boxes that we're supposed to have, but I want more of this, or I want to learn more about this, and that's when I say a deficit. I don't think the residencies are doing a bad job. Please don't take it that way. I think they're doing an excellent job, and I think they've come a long way from 21 years ago when I was a resident. So that's great. But if we don't start, like, keep looking higher and better, like how can we master our skill set, right? Then we're really, really not doing the job. We have to never be satisfied with where we are, right? We have to keep pushing forward to just always be better.
Absolutely. Sorry, Joe, I didn't mean to start hogging the interview here.
No, this is what's so fun about somebody that we're already a little bit comfortable with, is we just want to jump in with all of the questions. And I love this discussion right now, because I think the other thing, certainly I'll switch to I language, as I've worked with more learners in various learning environments, operating room, academic in a classroom, workshop that's two days long. What is so interesting and has become a universal experience for me, every learner is different. And this is of course it is, right? All the things that we know, but it truly, one person isn't going to feel comfortable the same way someone else is in the exact same environment. And everyone needs that opportunity to finesse those skills. And I like that's a nice way of phrasing, what do you personally feel like you need a little more just exposure and experience to? It doesn't mean that you didn't get it, but what do you feel like you need to be successful, and make sure that we can bridge that gap for you? Because
Absolutely,
it's such an important moment for a resident. And it's hard, because I'd love to get your take on when should they apply, when should they start thinking about this, because these are the questions sometimes that don't actually start coming up until the end of their second year, and now that application cycle is maybe over. So can you talk a little bit about, if you were talking to an early learner, let's say a fourth year student, what are some pieces of advice or frameworks that you would have them start lenses to look through, to start thinking about, is fellowship something that might be useful? Or do you think that's too early?
I think that may be a little bit early for a fourth year, right? But what I would tell them is, obviously pick, the residency where you feel most at home, right? And then hopefully it works out for you, right? Fingers crossed on the match, right? The second portion of that is, as you go through that fellowship, that residency, if you're going, gosh, I don't think we do enough of this here for me to feel comfortable when I'm out, right? And you'll get a flavor of that within the first year to year and a half. So somewhere into that second year, I can see that I may need more of blank when I go out to practice. That's a good time, somewhere in that kind of middle of second year, to really kind of start looking, right? Feeling out which fellowship is going to be right for you. And that's the way to do it. I also think that, within Balance Health, and just for clarification, so our CEO doesn't kill me later, is that I'm part now of a very large group called Balance Health. I think we're cresting somewhere between 270 and 300 doctors. And I'm one of the regional chief medical officers. But in that role, what I've said is, across the our group, we need to covet fellows of, okay, this fellowship would be great for this resident. This fellowship would be great for that resident. And that way, we're making sure that we're placing fellows where they can succeed, where they can fill those deficits in the best learning environment possible. And I think outside of Balance Health is that if you're looking around, go, okay, well, hey, that fellowship will meet what I think I'm missing, right? And that can be exactly that: confidence, certain skill set. It can be number of cases of blank that you have a true interest in, that's not every day in a resident learning environment. And those are the things that I think we should need to focus on from a fellowship director standpoint of that's how we can fulfill the next generation, right? I'm a type 2 diabetic. I need to make sure there's somebody out there to take care of me and do a good job of that. So I want to make sure I'm doing my part to educate the next generation.
I love that. Jeff, your thoughts?
Yeah, Devon, how long have you had the fellowship going?
So Jeff Hopp and I started a kind of co-directorship probably, gosh, I want to say 8 years ago. Our first fellow currently works for us. And so I want to make sure I get that number right. Otherwise, they'll never let me forget it. How would you forget your first one? And then a few years ago, the volume just grew so large that we knew we had to kind of separate because we were at different institutions. It was becoming too much. And so we wanted to create a good environment for those fellows. So we separated the fellowships. And so we started a true artisan foot and ankle one. We were at year 2 as far as that goes, but I've been involved in some level of fellowship training for eons. And there was a residency back down south here forever ago. And interestingly enough, my main business partner was one of our residents. So it's one of these things that I think I've kind of fell into because it's just interest and a love and a passion for it. But it is utterly fulfilling to see that next generation move forward. And it's great. I will quote one of my previous fellows, Raquel Seguina. Most people know her as Rocky. And one of my past fellows was having a tough time during his year. And he called her and she said, just keep your nose to the grindstone. That man taught me how to really be a surgeon. And I'll never forget it. It was so endearing and so heartwarming because I didn't hear that from her. I heard it from the current fellow. And I was like, wow, because you never know the experience you're really giving them, right? You think and you try to give them a good experience. But that was, if my fellowship ended the next day, that was enough for me to hear that, okay, I've done my part in society.
That's so great. So if you brought all of your past fellows into one room and, oftentimes I hear terms like, oh, it's shortened my learning curve, doing this year of fellowship. Or another thing that Joe and I often hear is it's vaulted my career forward from a surgical perspective, patient care perspective, X amount of years. What's your take on that? What would you say your fellows experience?
Yeah, I would say that it was probably the most grueling year that they've ever had in their life, right? But they walk away feeling confident in whatever space that they want to fill. That is my goal all day long is like, if you can leave here and go like, wow, I did this and I made it through that year and I feel like I've gotten this, breadth of experience. And it's not just surgery. I mean, that's one thing that we forget is everyone just thinks cut, cut, cut. But I tell everybody, even my patients, that the surgeon has to be balanced by the doctor. When it's time to operate, surgeon light, turns on, right? But in the office, it really has to be the doctor that goes, is this really right for you? And part of this fellowship experience, I really focus on, hey, clinic is important because if you don't know how to work up that patient properly, gain their trust, what you're saying to them, and then, also be able to have the relationship with them when a complication occurs after surgery and in that post-operative period, you're really missing a large part of what we need to be a good podiatrist, right? We need all facets of it. A great surgeon is not great until they know how to really talk to a patient.
Yeah, it's like that old quote. It's one thing to know, it's another thing to understand. And it's kind of like to get to that next level, That's so neat because, Joe, when we interviewed Ricky Patel a few weeks ago, and he had spent a year with Doug Piccaccio, he said, if I remember correctly, Joe, he said that year vaulted him forward like 5 years in his clinical career. I just thought it was such a neat testimony to what a great, busy year of fellowship can be.
Agree, totally agree. It's definitely a way to just pack in a bunch of information that sticks with you going forward. And I tell everyone like, hey, this year, one, I'm a complete workaholic for anyone that knows me. But so it's tough keeping up. I understand it. Even at 52 now, I people are like, I don't know how you do it. And then, thankfully there's plenty of caffeine around. But but that being said, is that it trains folks for a wonderful work ethic that won't fail them, and it does vault them forward.
Oh, and a technically well executed surgery on the wrong patient can still have catastrophic results. So I
Absolutely.
fully agree. And I like this too, because through this lens of talking to residents about areas that they may feel a deficit in, a lot of our residents are coming out feeling very comfortable in the comfort curve spectrum of the operating room, but they may not feel the same kind of comfort in terms of patient selection, post-operative complications. How do you have a difficult conversation with a patient? How do you deal with an angry patient? And depending on the residency program that they're in, those actually might be areas that it's not necessarily, they may want to finesse some of their surgical skills, but they really want that. Ooh, I just hit my button on my chair with my foot. Sorry, that's a funny outtake. So they might want a different experience of what that finesse really looks like in terms of how does this patient and this doctor interact with one another. Can you talk a little bit about how do you structure that time for your fellows? Do they have their own patients that they see? Do they go with you? How does that work in the exam room portion of your fellowship?
That's a great question. And yeah, we don't turn them directly to the wild. They'll eventually get turned to the wild. But basically, that first month, I just have them follow me. And I'll tell them, jump in when you feel comfortable. My patients are well versed that I have a new fellow each year, and they all become attached to that fellow. But it starts with that beginning relationship of I want to have them watch me interact with the patient. And then from that interaction, I think it hopefully shapes them so they feel comfortable on their stage. Because frankly, when you're sitting in that exam chair, right, and on the stool, that you're really on a stage, right? And you have to present yourself in hopefully a clear, concise manner that patients feel comfortable telling you, "Oh, I'm not sure. Is that really going to work, doctor?" Where they feel comfortable enough in that environment that you can have that open and honest conversation. And once they start kind of mastering it, and everyone is a little bit different, they have their own fellow clinic, and it's basically they're seeing the initial post-operative patients. I won't be there, so I don't steal that attention away. But basically, we'll chat about each one of the patients and go, okay, this is what we want to do. So we kind of guide them through that process. So that way, they're getting the initial experience of how to deal with the patient in that post-operative environment. They still then work normal clinic sessions with me, and we take care of like plantar fasciitis to complicated revisional surgeries and everything in between. And each one of those has a certain kind of value to the patient, right? A bad plantar fascia patient that you cure with conservative care can be one of your most vocal proponents in their community, right? Even more so than the most beautiful executed MIS bunion you've ever seen, right? So with it, that's how we kind of create that clinic value of understanding of building that patient relationship. And you're absolutely right. Is I've had, when I asked, like, what is your deficit? And I've had one that came from a fantastic program. It was like, I'm not really sure how to operate in the office setting, right? And the idea is, okay, well, let's get you comfortable there, right? And go from there forward. And you said it wonderfully. In the operating room, I think it's not only finesse, but it's also, I tell every single one of them, you may see me do something that you've never done before and may even seem weird to you. And that's okay, because you were trained in a certain kind of, cone, and you only learn what's there, right? And the idea is for us to kind of expand out that knowledge to another level. There's a multiple way to do things and still get a good result out of it. And I think that's the other part of even well-trained, residents who came from, the most elite program ever will learn something and take something from that fellowship moment.
Oh, I love that so much. Jeff, your thoughts?
No, I think it's fabulous. I have a question about the overall structure of fellowships, even nationwide. Love your opinion on this. I mean, CPME has guidelines for residencies, right? And there's also CPME approved fellowships. Should there be a curriculum for different fellowships, whether it's surgical or wound care or dermatology? Should there be a base curriculum and then expand from there? How do we know that the fellows are getting what they think they're getting or what we purport
Correct.
them to be getting. Is that a fair question?
It's a very fair question. I think a bit kind of controversial on who you ask, right? But at the end of the day, we're really here just being good stewards of the profession and trying to lead the next generation better, right? That's really, if you're doing this the right way, that's our job at its base. And doing that, you nailed it, is that each one of these fellowships could have a potential, choose your own adventure course, right?
Right.
And so if someone goes, gosh, I just love limb salvage. I could care less about trauma. I never want to see a bunion ever again in my life, right? Is that we should have fellowships to where you can have that. You can meet, a certain level of curriculum that goes, okay, this is a proper executed fellowship, right? Same holds true if some people just love doing MIS forefoot surgery and it's the amount of money being poured into it from a technological standpoint is mind-blowing, and you can have a whole subspecialty in that in itself, right? And maybe we foster some of that just the same, as well as trauma reconstruction. The wonderful thing about our area of expertise is there's so much different stuff that you could do. If you have ADD, you can never say that you get bored in a specialty if you're doing it right, right? Because one day you can be an orthotist, the next day you can be a dermatologist, next day traumatologist, the list goes on and on if you really look at the limb and its totality, right, of what you could do. So I think in getting proper training is that I think as time goes on, we really should define that almost into a subspecialty other than just saying, I was fellowship trained.
No, I agree. I'm going to take a little snippet of what you just said and put it into my student recruitment videos.
Go for it.
And it's so true. I've said this
incredible.
before. My biggest fear was that I was going to go into a job that I would get bored. And now, like, I can't tell you what I would give for a day of boredom. I mean, I'd probably get over it very quickly, right? But like, there is no opportunities to be bored. There's like stacks on stacks of things, and you could even get involved in even more of them. Which, before we completely get off the educational topic, speaking of bit workaholic and busy, you have been a lecturer at multiple conferences. You were the chairperson for the Western, which is how we first met. Can you
Yes.
talk a little bit about the educational space in terms of CME? We now have live in-person events. We have live streamed events that are held virtually. We have on-demand virtual. What are your thoughts about CME and where do you get the most value?
Well, obviously, I'm slightly prejudicial because I'm still chair of the Western. They haven't fired me yet, so that part's good. But obviously, I love the in person, and how we've kind of changed the Western to be more in person is to make it more tactile, right? So the idea is on floor labs. One of the vendors brought a van this year, which was a huge hit, and people being able to touch and feel and do stuff. I think the other thing about being around colleagues in a live setting where you can chat back and forth of like, oh, I like that lecture. Oh, that one didn't resonate for me. I believe this. I think there's learning aspect to that, right? Of getting someone else's take and understanding, oh, maybe I didn't think of it that way. Maybe I should think of it that way. And that's really what we're trying to do. I think, the kind of Zoom style meeting has its place as far as that goes. But what we're finding is since COVID has come and went, is that we're seeing more and more in-person people show up every year. So I think they're looking for that tactile experience. I also, with Christy, who is a great addition, and Neil Mansdorf, who's been there longer than I have, the three of us together, and what we've kind of melded of, okay, let's make this experience also more interactive amongst the participants. So rather than going up and hearing a lecture for 20 minutes and the next person coming and giving a lecture for 20 minutes, is make it a little bit more spicy, right? Make the subjects a bit more controversial. We've luckily now have a name to where we can bring in, folks that really want to be there. But that kind of talking about controversies in a friendly but collegial environment that can get, a little bit spicy is great. I mean, everybody loves it, right? It's kind of like the new talk show. And what it does is it spurs learning. which is what we're there to do, right? And it makes that learning exciting. And if you're there, you can feel it. It's kind of my vision is watching a concert on TV or being at the
Yeah.
concert is a much different vibe, right? And
Oh, I
so
love
what,
that analogy.
yeah.
Yeah.
And I mean, I think we want to all feel like you're at the concert, right?
Yeah. Oh, I love that. Because then you can even translate it to buying the CD. You can listen to the music whenever you want, the on demand. That is such a great analogy. I might have to steal it. I will totally credit you for it. But yeah, because I'm a
It's
music,
great.
I'm an audiophile by nature. So it resonates very well with my analogy. So
Yeah, I just came up with it, so I'm glad that that worked, and
yeah.
I'm pretty sure that our board is going to be very happy. Like, oh yeah, say it, Glazer.
Yeah, no, I think it's one of those like a picture's worth a thousand words. That really
Absolutely.
summed it up
Yeah.
because it's like I've been trying to put my own like finger on exactly what it. I'm very impartial to in person, and it's because it was interesting during COVID to have the opportunity to engage virtually, but as soon as it started to become back an option, like I am a extrovert. I missed that humanness of what we do. Like I don't want to just put something in Chat GPT and learn. Like I can do that, right? Like I want to hear from people. I want to engage. I want to talk to each other. And I loved the tactile, like what did we do when we're in person? Like how do I get my hands on different things? How do I get
Yep.
to not downplay the importance of what we do, but play with this new technology and get to monkey around a little bit with it. So I can mirror those sentiments. And I think it was incredibly successful. I know there was a lot of really good feedback after that particular course, but you've also done the SLES and multiple others. So again, not to downplay the other experiences that you've contributed to. Jeff, what are your thoughts about this virtual versus in-person CME kind of engagement?
I like the concert analogy because if you think about going to a concert, you're hanging out with all your friends and you're, taking pics and you're listening and singing together.
Yeah.
It's not
So
unlike
true.
being a resident where you're with your other co-residents and you're all sharing stories and experiences. And it's the same thing at a conference. If you're
Yeah.
together with your friends, and to your
Agree.
point earlier, Devin, I really enjoyed that. I think this is my experience. I think it goes a long way. One of the things I thought, Joe, right off the top of my head is Zoom CME is great on June 29th or 30th when you've got to get your credits done before July 1st.
That is very true.
Yeah.
I mean, my
Yeah.
hat's off to them. I've had to do that several times over the years. But
Yeah.
anyways, I totally agree. I think the human connection is something that you just can't underestimate in terms of its worthiness, right? And I think hanging out
Yes.
with friends and seeing people, and you're fortunate. You've got Disneyland down the street, or in Orlando, you go to Disney World, or I think a destination to go to where you can bring your family and things plays into it also. So there's a lot of variables going on.
My kids never want me to quit for that exact reason. And I was like, they could fire me in a year, but so you never know, right? And they're like, oh no, Dad, you might gotta do a good job this year. I go, okay, I'll try my best just for you guys, and 800 some podiatrists as well.
Well,
But
I have a question for you, Devin.
sure.
The Western, I mean, it's been around as long as I am thinking, I remember. Didn't Dr. Leibovitz, he was kind of overseeing it for many years.
He was.
When did it start? I can't even remember.
This is very sad and embarrassing. I actually don't remember either. And then, after my years of serving on the CPMA board, they're like, oh, hey, by the way, why don't you come help out with the Western, right? And we still have you around and everything else. And working with him for years was great under his tutelage, and he gave me a great path forward. And being chair, and through that process, we're able to bring on other folks as well that have also been great contributors, right? So I really honor all those in the past and all those going forward, because it is kind of a legacy of kind of passing a torch. But the one thing what I was going to say was, so, and Joe, you made me think about it when you were talking about everyone chatting, and to Jeff, was this year, particularly because we really try to ratchet it up on the kind of debates that we had over, the most controversial subjects we have, and standing outside when people came out and going, oh, no, I don't agree with that. I think this is better. Right. You see them, in a positive way of
Mhm.
participants, attendees chatting because the people on stage got them inspired to think or like, wow, that was crazy. I never thought of it in that concept before.
Yeah.
And to me, that was beyond soul fulfilling of like, okay, we're doing a good job. This is what we want to have. Right. And now I will now use that, of course, of the concert experience, right? Who doesn't want to be there?
Yeah,
Who
and
doesn't want to be there? I
as
love
we're
it.
talking about leadership, Joe, it reminds me of that slippery slope of saying yes to things, right? Um,
Yes.
hey, Devon, will you give us a hand with this conference? The next thing you know, you're running the darn thing, you know?
That's exactly what you would pretty much happen. Yes, yes, along the way, and I do it gladly, and I'm happy to do it and give back. And this is something my family doesn't mind me doing versus CPMA, which gave me a few gray hairs and maybe some loss of like male pattern baldness up here along the way. But all of it is doing good work, right? For us and for the next generation. And I think it just makes us a better podiatrists at the end of the day doing these things.
Well said.
Oh, beautiful.
Yeah.
Before we transition into leadership, Jeff, I thought we could take a quick break to hear from our sponsors of the show, and we'll be right back.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
All right, well, welcome back. Thank you again for
Thank you.
coming on to talk about all of your experiences in the education world. But you're also, we had touched on kind of board of directors for the California Podiatric Medical Association, and you're also part of the board of directors for the American College of Foot and Ankle Surgeons. And I'd love to get your take. You had commented on this kind of service, doing things that matter. What is it about professional service that really helps move the needle in regards to impact? How is it being on a board of directors? How does it do that in terms of moving that mission?
So it really kind of puts you front and center of what your community, otherwise known as society, to most of us think about it, what they need, your patient population. And it gives you a direct finger to kind of touch the future and help guide that future in a positive light. When I was on the board of directors of CPMA with Rebecca Mulmer, she brought up this concept of like, hey, we have these leg ulcers that are below the tuberosity, but technically we can't do anything, but no one wants to touch them. And these patients end up in a disastrous realm. So we put forward a leg ulcer bill, which we got passed with no opposition. And it was really through just kind of working through the channels of going to folks that would normally kind of oppose and go, well, why are you opposed? Right. And then, okay, what would make you say yes? And how does that opposition that you currently have protect a patient or help a patient? And if you have trouble answering that, why are you really opposed? Right. And it kind of brought to light a lot of different things of, well, maybe we shouldn't, or no, that doesn't make sense. You're right. We can help, patients better together if we kind of follow these roles. And it's been something, that piece of legislation passed on my watch, which we're utterly proud of, because we did it together, not only for the patients, but we did it together amongst the other societies, right? This wasn't this kind of battle royale or anything else of scope talk. It was, we're just all trying to help patients. We're really good at this, and no one else really wants to do it. So, let's treat these patients right and get them better and do it together. And I think, everyone saw that and kind of goes, oh, well, this is a noble process. Let's support this process the best we can. And for that, that was like one of obviously a very fulfilling moment in my life. And I know everybody that was on the board at that time, because together as a collective group, we shaped positive healthcare in California, right, for a very in need population. So it was kind of one of those things of like, if I hit a bunch of nuns crossing the street the next day by accident, right? Like I'd still be okay because I did some good things, right? I'd apologize to everybody, but it was one of those life fulfilling moments. Like, hey, you've done some good deeds, right? And I think when you talk to young folks in leadership, is we need them. Because I can't do this anymore, right? Like there's only so many candles I can burn at both ends. And really, they need to carry that torch forward. You can't wait for it to happen. You have to make it happen, right? And healthcare and society is ever changing. So to all the young folks that are listening, like we need you, right? This is the Uncle Sam old ad for the army of like, we need you out there fighting that kind of good fight for the patients that you take care of. And there's plenty of good folks out there. And once you get a taste, all I can tell anybody in the young world with leadership aspirations is it'll only make you more successful. It teaches you how to talk to people that may be completely on the other side and bring them to a happier place, which happens in our office with patients, right? It can also train you how to be more efficient because you have to juggle 5 different things at once, which you have to do in an office to be successful or in the operating room, right? So it teaches you that equanimity under stress over time. Everyone I've ever known that's gotten a leadership has become exponentially more successful because of that leadership experience. There's something innate about it that it just pushes you up.
Oh, I love that, but I'm gonna let Jeff go first.
I don't know. I have all these little cliches. It makes me think of the one, you either make it happen, watch it happen, or wonder what happens. So
yeah, I like that. That's good. That's good.
So to your point, Devon, making things happen isn't easy though. It's like swimming upstream sometimes.
Yeah, exactly. And sometimes rocks fall down that stream right at you and you have to dodge them, right? Take a couple little bruises on the way. But even with that is that when you don't win the first time, I think persistence and logic and forging those relationships, that's what makes the difference, right? People understand when you're genuine. And I'll never forget, it was at an APMA conference years ago. And a reporter, I don't remember what reporter was talking about, and was like, oh, things used to be simpler in DC, and not to go too far down a political track, but basically what he said is all these politicians that were across the aisle would go to their soccer games, their kids would be at the same soccer game, right? They would break bread together. They would have drinks together, and they may argue on the floor, but then they would shut the door and go, okay, we have this problem. Let's solve said problem. How do we solve this problem? Meet somewhere in the middle, right? And really for the good of society. And I think, and kind of our political leadership aspirations, if you have that mentality, you'll really kind of achieve the goal, long as your project or process is pure.
Oh man, there are so many things here. We are not a highly political show, but
No.
just considering current events, right? We're in one of almost at the standoff of the longest shutdown of our government. And I appreciate this so much because actually one of the questions I had written down to ask you about, you had already kind of touched on in terms of how leadership transitions into not just being a leader in a niche, but then having real world growing experiences. And what I find so frustrating in the political world is it's easier to just fall back into culture problems and not actually work together to solve the problem, but just start to like point the fingers and throw the blame at everybody else. Yep. Because then you don't have to do anything. And I just feel like that's just such a non-helpful way. Like that we're not gonna make progress when 2 people aren't willing to talk with each other. And so 2 things that I heard when you were talking about some of the experiences that have helped you grow as a person and clinician were what sounded like active listening, really listening to hear what the other person is trying to tell me, and curiosity. And so I'd love to get your take on how does communication bind that like divide, what are the ways that we can help support each other to bridge that gap?
So it's that active listening. Yeah, I mean, you nailed it. As soon as you said that, I was like, she gets it. It's that active listening is really when you ask somebody and you put in front of them, okay, what are you upset about? Right? You just with patience and, say, I'm so sorry to keep you waiting. And I understand that you're upset. So you kind of validate whatever they're going through and then go, what's frustrating you today? Right. And you use that simple methodology of active listening. You let them talk, and people will, I mean, anyone knows me. You let me talk, like I'll talk all day, right?
I know nothing about that.
But the reality is, they will give you everything that they're upset about, and where they stand in the certain position they stand, and why they're in the opposition to whatever you're worried about. And then from there, I think you go, well, what if we do this? What if we, try this method? And I think that's how you make the difference. And you said it beautifully, was active listening. And we don't do enough in that. We do a lot of active talking, but we don't do enough active listening.
Yeah. What are your thoughts, Jeff?
Yeah, couple thoughts. One, Devon, was when Joe and I were planning this podcast today, one of our defaults was we're just going to ask Devon a question and let him go.
You're like, Devon, we're 3 hours into the interview. We're going to have to call it.
No,
we love guests that talk.
Oh my gosh.
It makes it so much easier. And sometimes we won't even get to a lot of the questions because you come up with other really interesting things like, oh, I want to talk about that. So
Devon, I have a question for you. When you're in a room with a lot of people that all have wonderful intentions, and that communication is essential to moving a task forward, there has to be a sense of urgency, right? Because you do run the risk of some analysis paralysis, I imagine.
Absolutely. Yeah. And I think in that you basically go, give me one problem, one solution. And the solution has to be the problem that you brought up. Right. And with it, otherwise you'll be there all day. And so if you get one problem, one solution, and what it does is that actually moves the conversation forward. Right. Because then where everyone is most worried about, and what their thought process is to, figure out the problem. Right. And then, a lot of times you can put that together, and as a group, you can come to a good summation of ideas to solve whatever task you're trying to get past.
That's fabulous. Oh my gosh.
Oh, and I love that too, because it also stops it from just being whining and complaining.
Yeah.
It puts that accountability and ownership. Like, we want to hear your problem, but you also need to be part of the solution. You can't just show up and just like whine and complain and then not be part of fixing it and just keep trashing everybody's attempts of saying, well, let's try this. What about that? And that curiosity part, you have to have that stake and ownership. I love that. This is why you're a leader, Devon. You've gotten all the pearls of wisdom.
Well, they were earned with every one of these gray hairs right here, right? They all have a patient name or political moment. This one could be my teenager that just started driving, though. That one.
Oh, yeah. I'd love to know who some of your mentors were.
So it's John Holtman, for one. He's led me through a lot of great decisions through my career, as far as that go. And interestingly enough, and most kind of Byron Hutch, Hutch has been so fantastic, and his base personality that I love and just latch right onto immediately. But it's interesting with some of the other labs I've been teaching with Lee Halad and Jake Wines. I've become good buddies with them, and it's really just the bonding experience of that. We have enough in common and enough different that we can put something together that's just really kind of magical in my mind. When we work together. And so those are people that have kind of helped shape me. But the reality is I look around, and even people that I don't like, if I see something they're doing that's really cool, I'll go, okay, I may not like all this other stuff they're doing, but that's interesting, that's neat, and that I can latch on to. So it's just always been the way that I've kind of looked at life, of just kind of take the best out of everybody that I possibly can. And with it, because people go like, like, how do you even talk to that person? I go, well, if they talk about this like one thing, like really it's interesting and they have a good take on it. So I try to look for the good that's there. Right.
Yeah.
And keep any bad far enough away from me, right? That it doesn't negate the good. And I think that's kind of the key, because the way I look at it is, if I stop learning or stop growing myself, then really, like, what am I doing? Right. I mean, I've clapped out. Right. And that's just not my base personality.
I love that too, because it goes back to that curiosity part of where you were saying, like, I want to get more information. I want to understand your perspective. Bad is a judgment, right? Like sometimes what people think, oh, this person and their ideas are bad, and someone else may not agree with that. And so understanding that, and to your point, seeing multiple ways of doing something and taking the things, hey, I like this and I like this and I like this, and I'm going to put them together. And that is also how we get to see such incredible innovation. Yeah. So I like that. It's like a nice full circle moment. Yeah.
Yeah. Yeah. And that's what I love, is just, that's where my curiosity and creativity mixed together is based upon that. And it was really kind of the base name of Artisan, was that idea of, if you look at a true artisan, they're using a craft, but some level of creativity to create something amazing. Right. Yeah. And that was the base of the name for Artisan Foot and Ankle, because that's how I look at it. Yeah.
Yeah. Jeff, any more questions before I ask him my final question before we go to rapid fire? Since we're already almost out of time, it's like a blink and it's gone.
We are. You go for it. Go for your last question.
All right. I can't wait to hear about this one, because I love fun facts about people that I hold in high esteem. You wrote a children's book. It's not a medical children's book, from what I understand, but I've purposely not tried to like Google it, because I want to have a genuine experience right now. So can you tell us a little bit about the children's book, and like, how did this start? And
absolutely. So our daughters always liked us telling them stories, right? And my wife and I had just come back. We'd go every year to Mardi Gras and dress up the whole thing, ride a float. And the kids were like, we want a story, make up a story. So I came up with the story with these frogs, Cletus and Clyde, and they lived out in the bayou, right? And I grew up in Texas, and I went to a little undergrad close to Louisiana border. And so it was like, and they're living in the bayou, and all they wanted to do was to go on vacation, right? And so where's the best place to find flies if you're a frog? Would be New Orleans, right? And so there was a whole thing about how they got to New Orleans and all the adventures along the way of how they got to New Orleans, right? If you say it properly. New Orleans,
love
right? It. And our girls loved hearing the story. So I would just tell it over and over again, to the point where I literally recorded it in one of their iPads so they could just listen to it. Because there's times like I would be out of town, they'd want to hear it. Yep. And then it's like, oh, wow, like, you should write a book. And I found an animator, and sure enough, got it animated. And I was like, I didn't expect ever to be, asked Oprah asked me to go on her show for like one of the greatest things, one of the books, the book club. But I did it because I thought it'd be something neat that my kids could have kind of going forward. So I wrote the book and, put it on Amazon. I think I've mostly sold to my patients. That's about it, and which is totally fine. But it was something that I could give them that would be generational, right? To their children one day.
I love this so much, and it's such another one of those like beautiful moments of someone whose core value, not that I'm going to choose your core values for you, but the things that I'm going to reflect back to you that I get from you, Devon, is this idea of curiosity, listening, and storytelling. Like, how do we make this relevant and valuable to you? And how do I help you in this narrative? And that's exactly what you've done in a whole nother spectrum of your life. And I just think that that's spectacular. So you might have another client of your book, because I'm totally going to Google it as soon as we're done.
I will gladly send you a copy. I'll trade you for a mug. How about that?
Okay, fair enough. Fair enough. I'll support you on Amazon. No, I love it.
Appreciate it.
let's move into rapid fire. I got a feeling this is going to be interesting. I don't mind going
Let's do
first. Devon, you and your wife want to go on a long weekend anywhere in the country, just get away from everything. Where do you go?
Switzerland ski resort.
Ooh, I like
All
that.
right.
Yeah, super easy.
But near Chamonix or where?
Flying to Zurich and anything from there is fine.
Oh, that's
There-
fab.
Yeah, when we've been there twice, and I remember the second time when we were flying through there, both of us were slack jawed just looking at the Alps, and we're coming from Italy, and we're like, oh, Italy was okay, and we looked at the Alps like, okay, we're mountain people. That's it. We're skiers. And we live by the ocean. We could care less about the ocean.
Oh, that's awesome. I have to ask the music question because of all the music analogy. What do you play in the OR?
So I will let the staff pick, with the exceptions of no doo-wop, no country, and no K-pop. I tried K-pop. I gave it an effort. Yeah, but can't do
No
it.
soda pop?
No soda pop. I mean, I can maybe get the dance down, but that's about it.
Oh, I love it.
But I do love all genres. I like a little EDM chill in the OR,
Okay.
and
All
then
right.
I would say like 80s, 90s rap is also good, and classic rock. Anything from those genres is fine. But the one thing is you can probably pick out with this lovely active mind of mine is there must be music playing.
Yes.
If there's no music playing, that's when I start losing it. I was like, where's the music? Get it on right away.
Yeah. Yeah, no, I'm right there with you. I was in the OR this morning, and I also have to talk. Having had residents and students for so long, I didn't have one with me today. I'm like, sorry, I said in my script check, I'm like, I can't operate without talking it. So you're going to learn how to do this today.
Yeah. Guess what? Yeah, you're part of the educational team today. You earned some CMEs today. You earned some CMEs today. That's hysterical.
So I've got a good one for you. But first, did you find podiatry or did podiatry find you? That's my first.
Ooh, that is a good question. Podiatry, I guess, kind of found me. I was working in a hospital just as a physical therapy tech, and it was right when HMOs hit the first time. And every doctor I knew was like, don't get into medicine. It's awful. It's all over. It was doom and gloom. And then I met a podiatrist, and he was like, my patients are pretty happy. I don't take any kind of crazy call like these other guys over here do. And he was actually probably the first one, I think about it, said, there's a wide variety of what I can treat. Right. So I'll treat, plantar fasciitis one day, I'll be doing a bunion the other day, and everything else. And he's like, I get to have, actually, pretty nice, lifestyle. I can work, life balance. That part I think was a lie, but that's to me. And I think I've chosen this, right? If I work on a grind, he probably did not. And, maybe I think his way is probably smarter than mine was, but that really appealed to me. The idea of kind of, because I would sit there and you see some surgeons and some doctors doing the same thing over and over and over again, and their whole day almost seemed a little bit monotonous to me.
Mhm.
And to me, if I was tossed like a whole bunch of different things throughout the day, that's where I would be happiest. Which is kind of, how I fell into this, very niche, like Charcot recon, revisional surgery, give me your mess of a patient, right? And like, I'm happy to see them type of scenario, is because I enjoy that challenge and something being different all the time.
So there's a second part to my question. Sorry, Joe.
No, you're good.
If you weren't
This is great stuff.
if you weren't a podiatrist, what would you be, Devon?
Ooh, that's a really, really interesting question. Well, I think I know. How I bought my first car was my mother was a realtor, and basically, and she worked for a builder, and she said, "Okay, you help me sell a house, I'll give you $200 commission for it." And so that's how I ended up buying my first car. I knew everything about that house, and I actually really, really enjoy like doing some level of kind of interior design or renovation. My wife and I have renovated 2 homes together, and it's the only thing that's almost cost us a divorce. because it's the only thing we fight about. We don't fight about money. We don't fight about raising children. None of those things whatsoever. Where to vacation, zero fight whatsoever. But if she's like, oh, it needs to be a mocha, I'm like, are you kidding? What's wrong with you? That's an eggshell. That's an eggshell all day long, right? So I think we joked yesterday, we were actually looking for a new chair, and the lady at the furniture store had these eyes like, are these two going to go at it? Like, there's no way that we can have that dark color. That's going to look terrible. And she's like, are you crazy? Like, it has to be moody. And we said, don't worry, this is how we are, only with this. And we would make a great TV show on HGTV. And so that's probably what it would be.
I love it. Thank you.
Yeah. Mm-hmm.
I think that's a beautiful place to end, Jeff. I mean, I could ask him a million questions, but I'll just do that the next time I see you.
Sounds great.
Over a beverage, perhaps.
Yeah, I'll be happy to buy.
That's fabulous. Devon, I echoed what Joe just said. I mean, we've been on for an hour and it seems like 10 minutes. So thank you so much for joining me.
You guys, just like a therapy session for me is like just open it up and here I go. Yeah, I feel the same exact way. Thank you guys so much for having me. I also want to thank my patients that because I forgot about the time change, so we had to move some stuff around. So thank you to them for allowing us to do that. I appreciate them just the same. And really, not only thank you to you guys, but thank you for everyone that's watching that is part of our future, our students, our residents, our fellows, our colleagues. Just keep doing everything right. I love to see it. And I'd love to see all of everyone out there making us all proud.
Well said, Devon. I can't add anything to that. So
mic drop.
To all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating. If you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in podiatric medicine. And Devon, again, we can't tell you how much we appreciate you taking time out of your busy schedule to join us. And I didn't realize you were rescheduling patients. So thank you so much for that, too.
My pleasure. And thankfully, I have very nice patients that are understanding. So
Dean's Chat mug.
Now they can watch you.
Yep.
Yeah.
Dean's Chat mug incoming to California.
I look forward to it. I do have 2 hands, so I'll be happy to have one in each hand. I love it.
Or one. I think you have 2 office locations, so you can have one at each office.
That's true. Oh, I like the way you think. That's fantastic. All right. Thank you guys so much. Appreciate it.
Have a wonderful week, everyone. Cheers. Bye-bye now.
Cheers.
Bye.